Good evening, my fellow classmates and also teacher advisors. My name is Caution Chen. Today I would like to uh, talk about my research dissertation proposal. My dissertation proposal, the topic is experience of nursing students in learning evidence-based practice in clinical practicum, a qualitative study. This is the agenda today. First of all, the introduction part, I will define the topic and also talk about some background of EBP. I would like to talk about the searching strategies behind, and then type of review of qualitative studies that I found. And then I will talk about the research gap, the objective, methodology, writer, ethical consideration, implication, and last but not least, it is the interview schedule. The interview schedule is simply the questions that I will ask the nursing student later on. It is just a preliminary thought at this moment. To define the topic, so what is EBP? What is evidence-based practice? It is a problem-solving approach to the delivery of healthcare that integrates the best and latest evidence and patients' care data with clinician expertise and patients' preference and values in the context of caring. There are 7 steps in doing EBP in clinical. First of all, we need to cultivate a spirit of inquiry, which means we need to ask why. Um, and then we ask clinical questions in pickup format. The pickup format is similar to what we learned pickle in the nursing research course, but then the T means time frame. The third step is to search for the best evidence, and then we critically appraise the evidence as the fourth step. Subsequently, we integrate the evidence with clinical expertise and patient's preference and values. We evaluate the outcome of the patient decision or changes based on evidence. And last but not least, we implement the nursing action on the patient, and then we evaluate them at this and then disseminate the EBP results. So what is learning? Learning is actually a relatively permanent change in behavior or behavior potential due to past experience. Process of acquiring new understanding, knowledge, behavior, skills, value, attitudes, and preference. So we acquire new things. We learn some new things, and then we lead to a relatively permanent change in behavior. Also, maybe we have a potential to change our behavior, and then this is learning. So what is experience? Experience means maybe we have internal experience of feelings and will among ourselves, and then we have also the feelings, the experience of the world and of others. With basically the experience will arise after carrying out a reflexive exercise. So right here in my dissertation, I interview the nursing students. We hope to know about their experience. So the interview will be regarded as a reflexive exercise. Importance of EBP in nursing education. So there are 3 main points right here. First of all, EBP actually guide clinical decision making among nurses. It takes evidence, clinical assessment and expertise, patient's preference and values into consideration before making any clinical decision. It somehow it can improve clinical practice and ensure nursing accountability, and then it develop organization culture to sustain practice. And the second point is it is important in nursing education because somehow in the academic institution or even though in the clinical setting, we utilize within under or postgraduate nursing education, and then we develop theory. This kind of action we require a reflection on research and practice, and then this is evidence-based practice. But unlike research utilization, this research utilization is critically appraise research evidence and implement into practice. But then EBP includes a patient-centered approach. They provide a framework that supports decision making in patient-specific situation, which means patient A and also patient B, even though they have the same clinical background, but then they have different um, preference and value. Even though uh, we normally practice in that way, but then if we value the preference from the patients, somehow our nursing action will be slightly different uh, with support from the evidence. So this is EBP. It minimizes theory to practice gap if we value the preference from the patients. Importance of clinical practicum on nursing students. This research talks about the clinical practicum enable nursing students on first of all, if they continue to practice in clinical setting, definitely it will be as it leads to an improvement in students' knowledge and skills. And then we have some learning activities to that we facilitate achievement for them to of acquire new knowledge and also new skills. But when they continue to practice, somehow it develop sense of coping, development of responsibility, and also confidence to continue to practice. Um, Moreover, the environmental familiarity facilitates the nursing student function well. And then if they perceive they have development after the clinical practicum, they continue to build confidence for them. And then it helps clinical practicum help to adjust the nursing student to being a professional qualified nurse because a clinical practicum provide a real image of nursing profession. Um, and then they could become a good team player through repeated practice. But most importantly, through clinical supervision by preceptor. So right here, if the clinical supervision with the preceptor, the relationship is supportive and also with a good one-to-one supervisory ratio, it helps the nursing student to learn well in clinical setting. But how about the importance of clinical practicum on nursing students' EBP development? Research shows that EBP is associated with the development of critical thinking. Critical thinking is an essential and prominent component uh, in the undergraduate nursing education. It is necessary to be introduced early in student development in both academic setting and also practice setting. It prepares nurse with necessary skills and dispositions, which means the habits of mind, attitudes, and also traits. These kind of things help to support EBP. But then research tell us about some characteristic to facilitate EBP learning, which is questioning, always ask, and then be open mind. Because if you close mind, you do not accept new things, you do not uh, really know how to use evidence, or maybe value patient's preference to facilitate to do EBP in clinical setting. Some strategies they suggest to facilitate EBP learning includes problem-based learning, reflective journal clubs, and also role modeling. And our research talked about the critical thinking required for EBP consists of capacity to the following. But then when you look at the PowerPoint, it's similar to the 7 step of doing EBP in clinical that in the third slide. This slide talks about the difficulties in implementing EBP in clinical. We have the nursing students and also nursing staff perspective. Talking about the nursing student, they think that the collaboration with the surveys with the academic partnership, it is a bit challenging, and then they have limited awareness of EBP principles. They are struggling to see how evidence contribute to practice. So, but then we actually know that evidence are continuously evolving from Florence Nightingale in 1880 to evidence-based medicine to now evidence-based nursing. The evidence are continuously evolving. We have many research talks about evidence, but and moreover, the variation of learning style among students. We need to be active learning to learn EVP, but if the patient are passive, it is difficult to implement EVP in clinical. Moreover, one more point. During COVID pandemic, we still are under pandemic, and then we have negative impact in clinical practicum. For example, the nursing student have decreased opportunity to practice in clinical. So right here about the session strategies, I want to search on the qualitative study that talk about EBP learning in among nursing students. So I use search engine. I use MATLAB. The searching keywords are shown below on the PowerPoint slide. But one point I want to emphasize, if I use the preceptor as a keyword, preceptor sheet, mentoring, clinical practicum, whatever, that kind of keywords, no qualitative studies were found. But then if I cross out preceptor sheet, just use evidence-based practice, student nursing, and also learn these three words, this kind of words, and I found 70 papers in total, but still there are limited qualitative research paper. Talk about evidence-based medicine, the qualitative studies. Research said that there are insight perception of GP trainee on evidence-based medicine learning process during learning conversation. So they trainee perceive reading and also appraise evidence to answer clinical questions. They learn through brainstorm and mutual discussion with their peers and also their supervisor on evidence, experience, and patient's preference. So trainees need to keep on questioning, prepare learning conversation like what we are doing in our dissertation course. They continue reading the evidence and try out in daily practice. Then these help the GP trainee to learn evidence-based practice in their profession. And another qualitative study talks about the physician's view on teaching evidence-based medicine to medical students. Um, they think that the medical student need to be active participate in the learning process. They need to identify questions by observing supervisor, practice EBM, critically appraise and understand patient's background and also significance of learning EBP. These kind of factors help the medical students to learn EBP. How about nurse? Nurse experience after participation in EBP changing program. The factors that lead to success include team support, continuous engagement, intra-team communication, EB project planning, and also continue maintain the focus. Through empowerment through the practice and not practice with evidence. The nurses report that their experience more fruitful after participating in this changing program. Other qualitative study talks about the action research that help to link researcher and also practitioner to discover changes of clinical problems. Continued. When we look at the points, it talks about the mentoring to work through collaboration. We invest time on research-driven clinical project. We need to learn the rationale behind if disturbance, difficulties, and also contradiction occurs. Learn the rationale behind, and then we modify our nursing action. For the and then we need to have the knowledge exchange. Different background, expertise, and also have different experience. The people, practitioners, researchers, they sit together and then they could exchange the knowledge and then modify the practice into an appropriate action that is suitable to use in clinical setting. Right here, the research gap. Research papers show many research papers show that the knowledge beliefs implementation towards EBP, evaluation on different pedagogical design and project, even also intervention for learning and teaching EBP. Also shows that the practitioner and academics feel on EBP teaching and implementation. Doctors feels on learning EBP, and also we have discussed the facilitating and hindering factors of practicing and sustaining EBP. However, the research gap that I found is no single qualitative study exploring learning experience of nursing students on EBP, particularly in their clinical practicum, in the context of evolving evidence, variation of learning style, and decreased opportunity in clinical practicum under pandemic. Right here, I only have one research objective, which is to explore the experience of learning evidence-based practice among nursing students during their clinical practicum. The reason is I do not want to narrow my findings from the nursing students, so I do not want to uh, make a series of research questions that level down my findings. That's why I only have one objective, which is to explore the experience. The sampling method that I found is convenient sampling. Every nursing student could meet the inclusion criteria and not meeting exclusion criteria, I will recruit them into my sample. And then the sample size, I do not have a fixed sample size, but then I will continue to sampling, I will continue the data collection, and also concurrent ongoing data analysis until I find a redundancy of the patterns. And then if I find that data saturation, which means that there's data saturation, and then I will stop sampling, I will stop data collection, and then just finish my data analysis, and then I will write the report. Sampling criteria, inclusion criteria and exclusion criteria I listed below. So I only recruit full-time nursing students that study in GASEP registration enrolled or registered nurse training program in GASEP training academic institution, include all the universities and also the nursing school or even the 美國專上學院 and then those kind of academic institutions I will include that. And the student should have at least 2 weeks clinical experience in the service partner, and then they do not have the nursing license from the nursing council of Hong Kong upon data collection. The exclusion criteria are listed below, but it is just the opposite from the inclusion criteria. For data collection, I propose to make an in-depth semi-structured interview per nursing student. It is a face-to-face individual basis. It lasts for at least 30 minutes to an hour per nursing student. I collect the data on individuals' perspective and experience. The types of data generated will include audio recordings for me to transcribe the items, and also the field notes for me to jot down the paraverbal and also non-verbal cues from the nursing students. So I conduct the interviews. The interviewer that is me. I ask questions in accordance with the schedule. But then might be, I'm not sure, but then I need to discuss with my supervisor whether I could hire an observer to take notes on cues, or I could do that. But then yeah, at this point I need to discuss with supervisor later on. For the data analysis, I will follow the framework that proposed by Brown and Clark on the thematic analysis. They propose 6 phases in their thematic analysis that are listed below. I will follow this framework to analyze the data. For the writer, we have 4 different aspects that we need to follow. That I need to follow to ensure the right that include dependability, credibility, confirmability, and also transferability. So for the dependability, I propose triangulation and also member checking. These 2 methods, the triangulation means I have different data collection method will be used. I include audio tapes and also field notes. For the member check-in, I will after I interpret the data, after I I transcribe verbatims, and then the verbatim will be sent back to the participant for validation of the meaning of the data. So for the credibility, again, member checking helps to ensure credibility and also peer debriefing. I will debrief with my supervisor until an agreement is achieved. For the confirmability, I will record a detailed interpretation of data. Oh, sorry for the uh, uh, yes, so right here, sorry, I typed it wrong. It should be detailed interpretation of the data, and then for the auditory, I will drop down the rationale on boards about the coding and also meaning of films. So last but not least, for the transferability, I will include a thick description. That includes adequate details on the site participant, epistemology, and also methodology that helps the reader um, to read the article, to read this paper in their particular context. Ethical consideration, called confidentiality and also privacy. I will ensure the anonymity by labels in the index system, which means for participant 1, uh, I will label them as P1, and then to ensure the anonymity. For the data will only be used for research purpose. I will store in a password encrypt USB, and then it only used for the research purpose. I will permanently delete all the data after research. The interviews will be conducted in a quiet place, free from distraction. It also allows the participant, the students, to skip any question that they are not comfortably answering. Last but not least, I will seek for approval from the ethical committee from PolyU before commencement of the dissertation. Autonomy parts, I will provide an information sheet about the research details and also characteristics. Before I interview the nursing students, I will emphasize to them about the voluntary nature of participant with a written consent signed. They also have freedom to quit study at any time, and if they count me about the quitting on the study, I will and the associate data will be also permanently deleted and will not be interpreted. And also they have the freedom to express their opinions in the interviews. Implication part, for the theoretical and methodological implication, yes, we have many research about the pedagogical design to facilitate learner to learn EBP or to teach EBP. However, is there a good way or we can group suitable pedagogical design together to help to facilitate learner to learn EBP? I do not think there are. I cannot find any single paper that there are groups of pedagogical design that they that they propose to for the learner to learn EBP, and I think this could be implication right here, and also how to communicate with the patients to deliver EBP evidence-based practice. So this is also the methodological implication. For the practical implication, after we do the research, which means we find the groups of pedagogical design, and also we find the effective communication skill, and then we could help to we could allow the nurse to practice in the clinical setting. So this is the practical implication. So last but not least, it is the interview schedule. There are 5 questions that I'm going to ask, and the first question will be how do the nursing student define or also describe evidence-based practice? Just I will ask them to share some scenarios that someone practice EBP in clinical, and also if EBP is missing, uh, do they have any scenario that associated with the EBP is missing, and also how the experience of the student to learn EBP in Practicum. And last but not least, it is their suggestion for the practical arrangement to improve or to maximize the opportunity on the EBP learning. So these last page are the reference. So this is the end of my presentation. So I'm now pass the time to the grant and invite my fellow classmates and also teacher advisors to give me comment and also inquire on my dissertation. Thank you very much.